Apple cider vinegar's shocking health benefits revealed. You've seen it everywhere. Apple cider vinegar, the so-called miracle fix for everything. Today we cut the hype and go straight to the science. What ACV can actually do for blood sugar and cholesterol, what it does not do for weight loss, and how to use it safely. If you want clear, evidence-based health videos with zero fluff, hit subscribe and turn on the bell so you never miss the facts behind the trends. Quick note before we begin, this video is for education only and not medical advice. If you have diabetes, gastroparesis, kidney issues, or you take medications like insulin, diuretics, or digoxin, talk to your clinician before trying ACV. Here's the one-line truth. ACV is not magic, but research shows modest and real benefits for blood sugar, and sometimes for cholesterol and triglycerides, especially in people with type 2 diabetes. For weight loss, the evidence is weak. Now let's go deeper so you can decide if it is worth trying for you. First, blood sugar, where ACV actually shines. Across multiple clinical trials, the most consistent benefits appear in people with type 2 diabetes or insulin resistance. Think of insulin resistance like rusty locks on your body's cells. The insulin key is there, but it does not open as easily. The main acid in ACV, acetic acid, seems to help in two practical ways. It can slow how fast food leaves your stomach, which turns a sharp glucose spike into a gentler curve. And it can improve insulin sensitivity after higher carb meals, so your own insulin works a bit better. How much change can you expect? Meta-analyses suggest small but meaningful drops in fasting blood glucose and modest improvements in A1C when ACV is used consistently for at least 8 weeks. These changes are not dramatic, but they are real enough to matter for some people, especially when combined with good nutrition, movement, sleep, and stress management. Set expectations correctly. ACV will not replace metformin or insulin. It is a helper, not a replacement. If your blood sugar is already normal, you may not notice much at all. ACV works best where the problem exists, which is insulin resistance and type 2 diabetes. A practical tip for everyday life. If you take ACV with a meal, especially a meal that includes starches, you may notice fewer post-meal spikes. Some people also find they feel a bit fuller after eating, which can make it easier to avoid extra snacking. Next, cholesterol and triglycerides, where ACV can help but with limits. Some studies show a modest lowering of total cholesterol and triglycerides, most clearly in people with type 2 diabetes who take about 1 tablespoon daily for more than 8 weeks. The catch is important. ACV does not reliably reduce LDL, the so-called bad cholesterol, and it does not reliably raise HDL, the good cholesterol. In simple terms, ACV can nudge the overall lipid picture in a better direction, especially triglycerides, but it is not a statin, and it is not a targeted LDL solution. Keep your prescribed therapy and think of ACV as a small assist, not a standalone fix. Now, weight loss, the most overhyped promise. The short answer is no, ACV will not melt fat by itself. A few small trials show minor benefits, likely because ACV with meals can increase fullness and lead to slightly lower calorie intake. But across the board, the effect is small. Real and lasting weight change still comes from consistent nutrition choices, a sustainable calorie balance, quality sleep, stress control, and regular movement. If you see weight changes with ACV, they are usually modest and they usually happen alongside a healthy diet. Let's talk about how to use ACV safely and effectively, because this is the part most people skip. The type many people buy is raw and unfiltered with what is called the mother. That is fine if you like it, but remember the active piece is the acetic acid in the vinegar itself. You do not need the mother for the metabolic effects seen in studies. Dose used in research is simple. Aim for 10 to 30 milliliters per day, which is 1 to 2 tablespoons total per day. Taking more does not increase the benefits, but it does increase the risks. Golden rule, never drink it straight. ACV is highly acidic. Undiluted, it can erode tooth enamel and irritate or even burn your throat or esophagus. Always dilute 1 to 2 tablespoons in a large glass of water, or work it into a meal like a dressing. Many people take it with meals, which may enhance blood sugar benefits and also buffers the acid. Using a straw can help protect your teeth, and rinsing your mouth with water afterward is smart. Timing matters less than consistency, but most studies pair ACV with meals. Choose a meal that includes carbohydrates if your goal is better post-meal control. Who should be cautious? If you have type 1 or type 2 diabetes, gastroparesis, kidney disease, or you take insulin, diuretics, or digoxin, speak with your clinician first. ACV can lower potassium and interact with these medications. Safety first, always. What about gummies or tablets? Be careful. Some tablets have caused esophageal injury in case reports, and product labels can be confusing about the true acetic acid dose. If you choose gummies, look for the actual acetic acid amount, not just milligrams of ACV. Liquid ACV, well diluted, is the most studied route and the easiest to dose accurately. Quick questions and fast answers. Do you need organic? Not required for the effects shown in studies, but choose a reputable brand you trust. Morning or night? Take it with meals for blood sugar benefits. Consistency beats timing. Can you cook with it instead? Yes, using ACV in dressings and meals is a tooth-friendly way to include it. How long until results? Most studies run for at least 8 weeks, so give it time and expect modest shifts, not dramatic ones. Can you stop your medications if your numbers improve? No. Never change prescriptions without working with your clinician. ACV is a helper, not a replacement. Let's put it all together with a practical plan you can use today. First, decide your goal. If it is smoother post-meal glucose or a gentle nudge on triglycerides, ACV might help. Second, choose your dose. Start with 1 tablespoon per day, diluted in a large glass of water with a meal. If you tolerate it well after a week or two, you can consider up to 2 tablespoons per day, divided across meals. Third, track something real. If you monitor blood sugar, look at your post-meal curves for 4 to 8 weeks. If you track lipids, give it at least 8 weeks before retesting. Fourth, keep the basics strong. No supplement replaces smart nutrition, movement, sleep, and stress management. ACV works best as part of a healthy routine, not instead of one. A few pro tips to finish strong. Use a wide glass and plenty of water so the acid is well diluted. If you dislike the taste, mix your dose into a homemade vinaigrette and dress a large salad at your higher carb meal. If your teeth feel sensitive, shorten contact time by sipping quickly through a straw, then rinse with water. If you feel nausea, cut the dose in half, take it mid-meal, or stop and reassess. If you notice dizziness, leg cramps, or any symptoms that could relate to low potassium or medication interactions, stop ACV and contact your clinician. Here's the final takeaway. ACV can provide modest, real help with blood sugar, especially in type 2 diabetes, and it may nudge total cholesterol and triglycerides down. For weight loss, it is not a magic bullet. The smart way to use it is 1 to 2 tablespoons per day, always diluted, preferably with meals, and only after checking with your clinician if you take relevant medications or have medical conditions. If this evidence-first approach helps you, please like this video, subscribe, and share it with someone who needs the real story on ACV. I have linked the primary sources and trusted summaries in the description so you can check the research yourself. Your health deserves the truth.